السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. I'm Faizah Alyahyawi, 6th-year medical student, and I will talk about fever in this presentation. So my objectives are definition of fever, common causes of fever, patterns of fever, and how to approach a febrile patient. First is the definition of fever. What's the fever? Fever is a regulated elevation of the body temperature that exceeds the normal daily variation as a result of an increase in the hypothalamic thermoregulation center set point. And we have many methods of measuring temperature, like the oral one, which is not accurate, and the axillary one, and the rectal method, which is most reliable method, especially in children. And then what are the causes or common causes of fever? We have infectious diseases, it is the most common cause, and also the malignancy like lymphoma, leukemia, gastric cancer, lung cancer, other cancers. The collagen or rheumatological disorders like rheumatoid arthritis, SLE, temporal arthritis, and also the autoimmune diseases like autoimmune hepatitis, Crohn's disease, interstitial lung disease, and also other medical conditions like MI, sarcoidosis, any head trauma or any other trauma, and also some physical causes like heat stroke, dehydration, and also some medications that can elevate the body temperature like antibiotics or methyl dopa. And also we have fictitious fever, which is non-reliable fever. Then patterns of fever. The fever either to be continuous fever that does not drop to the baseline, or intermittent fever, the fever that drop to the baseline then elevate again. Continuous fever like sustained fever, stillbladder fever, remittent fever, hectic fever. Intermittent fever like in form of biphasic fever, tertian fever, undulant fever, relapsing fever, and Bill-Epstein fever. And each of these patterns of fever have some common conditions associated with, and this is the examples of patterns of fever. How to approach a febrile patient? The most important point is to take a detailed history from the patient, especially a personal history like age, occupation, the place of origin, any specific special habits. Ask if the patient has any underlying disease or any underlying condition, any chronic disease. Take detailed drug history and ask about family history, any similar condition, any chronic disease in the family or infectious condition. And we should also focus on the social history, traveling history, animal contact, and exposure to insect spies. Then we have to examine the patient, the general examination and local examination. We should look if the patient has any rash, any jaundice, any lymphadenopathy, any problem in the mouth or oropharynx, any problem with the eyes, ears, any signs of meningeal irritations, and systematic examination. And also we should do rectal examination. Then investigation for the patient. The most important point is to do laboratory investigation for infectious disease, and we have to either to direct demonstration of the organism like by microscopic examination for the body fluids, for the to take tissue samples, and we detect the organism itself, or either by indirect evidence of infection like by detection of specific antibodies by, for example, ELISA. Then the treatment strategies or how to treat a patient. We have acetaminophen or paracetamol is the generally first line antibiotic due to being tolerated with the minimum side effect is the first line. Pediatric dose 10 to 15 milligram per kg, adult dose 650 milligram. And we can try water sponge bath, remove planks, remove heavy clothes, keep the patient in comfortable room temperature, and don't give children aspirin to avoid Ray's syndrome. Also we can use NSAIDs. And we have some indications for hospitalization of febrile patient, like if the patient is clinically unstable, or if the patient has major alteration in the immunity by investigation, or if the patient in need for IV antibiotics. And this is the end. Thank you so much.